Hi there, I'm Abby. I'm going to be doing my sterile wound dressing video. So, knock, knock, knock. Hi there, can I come in? My name is Abby. I'm going to be your nurse today, and we are going to be doing a sterile dressing change. A sterile dressing change basically consists of taking off the old dressing and putting on the new. Before we get started, can you tell me your name and date of birth? I have with me John Doe here, and John Doe's birthday is 1/1/90. So I'm also going to ask John's allergies, which he has none, and I'm going to verify that with the wristband. So I'll just be looking at the wristband to verify, and everything looks good. So I'm going to verify that there's orders in the chart to do a sterile dressing. So I'm going to log on and look to see if there's orders, which we do have. And also, before we get started, I'm going to ask about the patient's pain. Do you have any pain today, Mr. John? No. Okay. If the patient was in pain, we would want to administer pain medications before and let that kick in before we started the dressing change. So everything looks good here. I'm going to wash my hands, make sure I have all my supplies. So for this procedure, I'm going to need clean gloves. I need sterile gloves, an ABD pad, multiple gauze. I need sterile saline here, which I'm going to look at, and I want to look at the packaging here and want to make sure that if it was opened, it had not been open for longer than 24 hours. So we are good here. We have non-open saline. So I have everything ready. And the first thing I'm going to do is wash my hands and put on my clean gloves, because we are going to take off the old dressing and see how the wound looks. So I'm just going to put on my clean gloves, and I'm going to take off the tape first, and I'm going to take off the tape towards the wound to prevent any tissue damage. So I'll be doing that, and once I have all the tape off, I will pick up the dressing and I'll look at the drainage and look to see what the consistency is, amount, type, everything like that, and document. So then I will discard. So then after that, I'm going to take off my clean gloves and provide hand hygiene. So I've hand hygiene now, and then I'm going to prep my sterile supplies here. And so I have my multiple packages of gauze that I'm going to open up here in a second. I'm not going to put on my sterile gloves yet, but I have them, so I'm going to take them out of the package and just set them to the side. So I have my sterile gloves here. Okay, and then I'm going to open up my gauze here, and I want to open the packaging away from me. So I have everything ready here. I'm going to open away from me again and again, because I want 3 packages at least. So that's all ready. I'm going to grab the sterile saline with the label facing my palm so it doesn't ruin any expiration date, and I'm going to moisten 2 of the gauze packages for cleaning purposes and packing purposes. So I have that done here. And then I am going to also open up my ABD pad and put it off to the side. So I have that here, and that's ready. So now I'm going to put on my sterile gloves so I can start doing the procedure here. So I'm going to make sure I have enough room and open my sterile glove package here. Without touching anything, and I'll grab inside. Okay, so now my sterile gloves are on, and I'm going to get rid of the package here. So now the first thing I'm going to do is clean, and I'm going to grab my gauze here, step away from my sterile supplies, pull all the corners in so I can provide some cleaning. So I'm going to go in and start at the front of the wound and go back and clean one side, discard, and do that for the other side and discard. So I have cleaned the wound now. The next thing I'm going to do is pack. And so I had already moistened this gauze. I'm going to grab it, string it out here with my non-dominant hand and get that ready. And so I have it ready here. I'm going to put it in my dominant hand and pack the wound. Okay, so now I'm going to put the clean gauze on top here, and then I'm going to use the ABD pad to additionally put on top of that. So I have it open and placed right on top, and I'm going to now take off my gloves. So I take off my sterile gloves And then I'm going to do hand hygiene. The next piece is I'm going to tape. And I want to make sure the tape goes around the ABD pad. So I'm just gonna get some tape here and make sure it's taped down. Making sure there's no creases in the tape. We don't want to have any skin breakdown. So then I'm going to make sure it's taped down. And once I have everything taped, I'm going to additionally put my initials and the date and time on the tape here so that they can see when this dressing change was last done. And then I am going to ensure the patient is comfortable, put them in the lowest position, call light within reach, do my hand hygiene, and document everything that I have just completed.